My name is Evan Lewis. I'm a clinical research scientist specializing in nutrition and diabetes complications. I'm based in Toronto, and I'm excited to be with you here tonight to share a new talk titled 5 Things Your Feet Are Trying to Tell You. And just given my background and some of the research that I've done, and some of you have listened to some of my previous webinars, there is going to be a little bit of a nutritional slant on some of the information that we're providing, because at the webinar is not just about giving information, but it's also a matter of trying to give you information that is actionable, that you can take back to your practice or your clinic and start using as early as tomorrow morning, as you start to see people who you might encounter some of the things that we're talking about here tonight. So a little bit of a background on myself. So I started into my research program as a former athlete. I was a competitive athlete on the Canadian sailing team, and I was really interested in human health, human performance. And throughout my clinical research, when we were focusing on the athletic side, our lab really did a good job of trying to work across different aspects of individual health through both excellence and into chronic disease states. So I was exposed to several different clinical conditions, neuromuscular conditions, and diabetes. And that aspect really stuck with me of how we can use nutritional interventions or lifestyle interventions to help people with different chronic diseases and really improve quality of life and clinical outcomes. So right now I'm affiliated with Mount Sinai Hospital in Toronto, where I'm conducting some of my research on omega-3 nutrition therapy for diabetic neuropathy, and looking at some other aspects of how complications present in patients with type 1 diabetes who have had diabetes for over 50 years. So it's a very unique group of individuals that our research team has. We've amassed about over about 300 individuals in Canada, which makes for some really interesting conversations and some interesting research as well. On a bit of a personal note, my family and I, we live just north of Toronto. We have a little hobby farm with a couple horses and some chickens, and we've been lucky to be outside of the city through COVID and get to do different things and learn new things every day. So we have a lot of fun. So about this talk. Today we're having a chat about the 5 things that the feet are trying to tell you. And when we were trying to narrow down our talk, we thought this is a really great opportunity to discuss different things about how we can identify different changes in health that might be early warning signs, and what one of the common things that we all share is foot care and how that relates to overall health. So in this webinar, I've talked with colleagues and we've tried to boil down the 5 most common cries for help, if you will, that you might see from your clients or your patients' feet. And they might be things that they're not entirely aware of. And you, as the clinician or the practitioner or the foot care professional, can use your skills and your knowledge and your experience and help identify a couple things that could really help improve the quality of life or help your patients and clients get the care that they may need. So these are the 5 topics that we've identified from chatting with colleagues, and we're going to go through a couple different aspects of each of them, just in terms of why they might be there, a little bit of the science behind them, and then in the second section of the presentation, we'll go into some of the recommendations about what you can do to help individuals who might have some issues related to these areas. So I wanted to start off just with, we're going a little bit top down, and these aren't necessarily in an order of importance per se, but something that I thought would help the presentation flow well together. And as I think about more about these different issues, and probably from your clinical experience as well, we're going to see a lot of overlap in some of the things that might fit into one category will cross into another. So I've tried to keep each of these fairly discrete as much as possible, knowing that there is a good amount of overlap. And starting with circulation, poor circulation is something that can be really interesting. I say this from a clinical perspective, but the foot can be an interesting early marker from several different aspects of circulatory issues. Given how far the feet are away from the heart, you have a great opportunity to start to see early warning signs of a number of different things. And some of them could be on the arterial side, whether it's a lack of oxygenated blood pumping, or it could also be on the venous side of circulation, where you could see an increase in swelling and lack of return to the heart. So when we look at circulation, the four most common, foot cries for help of poor circulation can start off with numbness and tingling, and that can be causing poor numbness and tingling can be a sign of poor circulation, which can cause acute symptoms of numbness and tingling because there's not enough oxygenated blood getting to the feet. And over time, if there's poor blood flow, inconsistent blood flow, and that gets worse, then the nerves in the feet, which are fed by the very, very small blood vessels, don't get enough oxygenated blood, and that can lead to nerve damage or even nerve death over time. And that will lead into some symptoms of neuropathy, so which is a clinical term for nerve damage. So while numbness and tingling might be a symptom of other issues, it could be also a symptom of poor circulation. And naturally, as we can see here in the image on the slide, swelling is probably one of the most obvious signs and symptoms, as we see venous pooling, a lot of fluid just being left in the lower leg and into the foot. Now, I'm sure a number of you, especially individuals that practice in Canada or northern parts of Canada, are used to seeing some aspects of discoloration and cold, I guess 3 and 4 lumped together. And that can be common in cooler temperatures and in our winter, which is just around the corner, it feels like. But we can also have some other things that we can discern from this. And we can test this by checking on, looking at our capillary response to see if there's any, if the nails beds are changing color if we press. And that's something that can be done in a regular foot exam to rule in or rule out circulation issues. But we can also see a changing color of the skin around the foot and up into the lower leg. And with that, if we see a pale or a gray color to the skin, then that can suggest decreased arterial flow, blood flow coming down from the heart. We can also see if there's some purpling to the skin, that can indicate some capillary issues as well. So a number of different aspects of where the circulation issue might lie. And while we're lumping discoloration and cold together, they can go hand in hand. If you're checking pulses or peripheral pulses, and you're not feeling normal pulses in the area, it could be a good opportunity to refer your patient or client back to their family doctor or a primary care provider in case they need a referral for blockages or peripheral artery disease examination. So, now, the second aspect in terms of what what the feet can be telling us is a lot about diabetes and prediabetes. And I realize there is a little bit of a theme of this disease woven through our five topics, but given where our population is, I mean, at this time, 1 in 3 people have diabetes or prediabetes, and these stats hold together fine, whether you're in the US or Canada. It's really similar. But I think what's important to stress here tonight on this call is that 20% of these people are undiagnosed. And it could be that an individual doesn't have a primary care provider. There could be a financial issue, there could be a lack of access issue, and perhaps they're coming to you as the foot care professional as to help to manage their feet and their symptoms. So it's really important, I think, that we acknowledge some of these signs, foot signs of diabetes that could be a very early warning sign that your patient or client could require additional support, and especially the support of a medical doctor to receive appropriate management and ongoing training. And one of the things that's really stuck with me from our clinical work with our neurology partners is that almost 25% of individuals with prediabetes have neuropathy. And often for these individuals, it's the numbness, the tingling, the loss of sensation, those classic neuropathy symptoms that actually cause them to go in and see a healthcare professional who then does some blood work and looks at some other factors as to why those symptoms might be happening. So something really important to keep in the back of our minds, that if there is some of those classical signs, that there could be an undiagnosed case of diabetes or prediabetes in your facility. And I mean, we know from some of the talks that I've given previously and shared that over time with diabetes, we can see up to 50% of individuals with diabetes having developed some level of neuropathy overall. So while those symptoms are a little bit more, oh, I think I'm on the wrong, I was talking on the wrong slide. There we go. So while those classical signs are a little bit more obvious, there's 2 other things that I think we should be aware of as well. And one is hair loss, and which I thought to be interesting, especially from the conversation as I've had with some clinicians. But hair loss on the say top of the toes, the foot, or the lower leg can be one of those early warning signs. And the reason behind that is that high blood sugar alone or in combination with impaired blood flow can cause hair follicles to not get the nutrition that they need. And that could be from a lack of oxygen alone, or some of the other proteins, amino acids, and vitamins that hairs need to grow. And so if they're not receiving those nutrients, then they will fall out. And finally, pain or cramping during activity can also occur because of poor circulation again, or impaired nerve function. But this can also be triggered during times of increased demand for either oxygenated blood or from increased nerve activity from muscle use. So if somebody's coming in complaining of cramping, it could be something as small as in the foot muscles or into the lower leg, then that's another something else to keep in mind in terms of an early warning sign for diabetes. So our third foot speak, or foot cry for help, if you will, is all about skin. And if we think about skin is an organ, but a crack in our skin is almost like a break in our armor. You know, the skin is really designed to protect our body, help and make sure that the outside environment doesn't get in. And we want to keep the integrity of our skin or our armor as strong as possible. And if we do have a crack, especially in the foot, which is an area which is very prone to higher bacterial loads, thinking about if somebody doesn't have the greatest foot hygiene, they're not changing their socks on a regular basis. These cracks, while they might be small at first, can make a great home for bacteria, which over time can result in definitely more serious problems. The other aspect, coming back to cracks in feet, and it could have gone in the last slide, but I decided to put it here, is that dry skin is also, dry or cracked skin can be a sign of diabetes, and a little bit of a back and forth relationship here. Diabetes or prediabetes can dry out the skin as a way of the body trying to keep homeostasis. And as blood sugar increases, the body wants to try and dilute the blood so the sugar levels go down. And essentially, to do that, the body's trying to steal water away from anywhere else in the body possible. And the skin has a high concentration of water. And over time, with high blood sugar and repeated periods of high blood sugar, the skin will start to dry out as the body is using that water to help excrete sugar in the urine. The other component is the diabetes can also alter fat metabolism. And while we typically think of this in terms of somebody having high triglycerides, maybe they're being on statins, it's not just about those fats alone. It's about a host of other fats that are necessary to keep the lipid bilayer of the skin fully intact. So as diabetes alters fat metabolism, the skin is not seeing or taking up the same lipids that it would have been previously. And as a result, there's a little bit of a skin nutrient deficiency, if you will, which can impair integrity over time. Okay. So we have two more areas to cover off before we go into the recommendations. And number 4 is a broader area of pain and heat. And pain can be derived from a number of different things, and heat is clinically we associate with inflammation. And this is an area that clinicians or foot care professionals need to pay a good amount of attention to, because if there's painful feet, something that comes on relatively quickly, there might be an acute injury that requires further attention. So while an acute injury, if somebody comes in with foot pain that's acute, it could be a sign of something like a sprained ankle, a stubbed toe, or an injury similar to that. However, we can also look beyond. There is also a chance that it could be beyond an acute situation, or an acute situation that has aggravated a chronic health condition. So for example, somebody was out on the weekend, Sunday, they were playing with their kids, playing with their grandkids, while they have some level of chronic arthritis, or say bursitis perhaps, or even gout, their activity over the weekend could have aggravated those conditions, so it appears like a more chronic situation. So it's really important, as we see these situations which are a little bit more, could go either way as acute or chronic, it's important to have a good relationship with your patient or your client so that you can get out as much information of what might have happened, because the feet obviously can't speak to us to tell us exactly what had happened. And it's also, a good opportunity that if you're suspicious about something or a possible underlying chronic condition, referring back to case notes or any notes you might have had with your patient or client's file to see if there is any potential for an aggravated chronic condition that might not have been mentioned or touched on in the previous few visits. there is the chance, and again, this is our theme of diabetes sort of weaving its way through here, there is a chance that pain could come on as acutely, which is a sign of diabetic neuropathy or other neuropathies from nerve injury. And while I bring this up, it is something that we've seen in our clinical work, both with our type 1 patients and others, where we do see individuals with neuropathy have periods where their symptoms can progress fairly rapidly over a short period of time. So again, there's always this possibility if an individual presents some other risk factors that there could be an involvement of a diabetic status that should be kept in mind while you're talking with your patient or client. So the final aspect of foot speak, or what our feet are trying to tell us, is about your immunity, your immune system. And what we know is that a strong immune system is important these days, full stop. It's always been important. But again, as we see this theme of blood sugar and metabolic issues, high blood sugar or poor diet, a diet that's higher in refined sugars, is known to impair immune function, full stop. And while this is important for all of our patients or clients, it's especially important for individuals with diabetes because high blood sugar and repeated exposure to high blood sugar changes the form and the function of our circulating immune cells, which ultimately lowers our overall immune function. But I mean, we're here talking about the foot, so there's absolute implications for the foot. And for individuals who might have a foot injury or cracked skin or be recovering from a cut or an injury of sorts, high blood sugar or sugar spikes can block the activation of the necessary growth factors which are needed to promote healing at the site of an injury or an infection. As a result, these can lead to a simple injury leading into a diabetic foot infection or a diabetic foot ulcer. And I think collectively we all know that those are things that we want to try and avoid at all costs. And we really need our patients or our clients to work with us to to really help keep that foot condition going in the right direction, and supporting the immune system and maintaining immune function is one of those really important things. And again, one of the other conditions that we might see is related to a suppressed immune system is a fungal infection under the nail or onychomycosis, and that has to do with the body being able, to a certain extent, the body being able to address the fungus which is starting to take hold under the nail. Okay, so that was part one, so the overview component, and we're going to shift now into the evidence-based recommendations. And with that, we're going to go back through each of the different aspects and what we can do either individually or collectively to contribute some of this new information, or maybe it's old information represented as a way to try and introduce a clinical action plan or some solutions for your patients or clients, or things that they can think about or you can help provide them with to help improve their foot health and their overall health. So again, starting out with circulation, our number one foot speak issue is some of our common signs and symptoms from poor circulation are numbness, tingling, swelling, discoloration, and cold temperature. And there's a lot of different components that can come into this, and as we discussed before, several different factors that can contribute. But if we're looking at a poor blood flow issue, trying to increase physical activity is one of the best recommendations that we can do. We want to try and drive as much blood to the area, and being active versus sedentary is one of the best ways to achieve that, especially if we're dealing with a swelling issue. So, if we can try and break up the day from somebody who might be in an office situation, might be sitting a lot, trying to incorporate short, even less than 5 minutes, 2 minutes, 1 minute of getting up, walking around, trying to get the muscles and the blood vessels working to help get blood flow down to the feet and try and help return any of the pooled fluid. One of the areas that my research focuses on, as I mentioned, is omega-3 therapy, because of the role that we've showed previously between these essential fats and nerve health and nerve structure and regeneration. But one of the other things that we'll talk about just quickly on the next slide is how these fats can help to improve peripheral blood flow. And finally, the third component that we can factor in is either socks that might be a bit thicker, or heating pads that are set or monitored to help keep the feet warm. We want to make sure that our patients, our clients, aren't getting too hot, or we don't want a risk of burn. So something that can be monitored or timed to prevent any secondary injuries. Now, I wanted to share a little bit on some of this other aspects, because I've talked a lot about omega-3s and nerve structure, nerve function, regeneration. But one of the other things that omega-3s can factor into is improving blood flow. And there's a number of different ways that this comes together, but essentially when we increase our dietary omega-3s, these fats are very fluid. And you can think about it, those the guys with the wavy arms, like at signaling, like you see them at car dealerships and stuff. So omega-3s essentially are very wavy in terms of their action in a tissue and in a blood vessel itself. It helps to increase flexibility or the dynamics of that vessel, if you will. So this will help to, overall, it can help to decrease blood pressure, decrease vascular resistance, which is great on a systemic level. But also when we see that on a localized area like the foot, we can get better blood flow through the smaller vessels because they're better able to respond. And this is also something that can happen through a process called flow-mediated dilation, where there's a little bit more blood flow to the area, which releases nitric oxide, which again helps to bring more blood flow through. And on a sort of skipping down to the immunity side, we know that omega-3s can also help to reduce inflammation, which is really important if there's any risk of injury, if there's any injury recovery going on as well. So now our second component was diabetes, and some of the typical signs and symptoms that we're watching for is a change in sensation. It could be numbness, tingling, pain, but again, hair loss or pain and cramping during diabetes or during activity. Depending on what you think or the relationship with the patient or your practice, this could be an opportunity to refer back to a care provider if they don't have one or they haven't been seeing them on a regular basis. But there's also something that we've come out with recently, which is Frontline Diabetes Supplement, which is a new product to go along with our omega-3 therapy that helps to reduce blood flow, helps to reduce blood sugar and provide some other vitamin and mineral support to correct some key nutrient deficiencies that are common in diabetes, and also can help with aspects of skin health as well. Now, Now, in terms of cracked skin, I'm sure since this is a Neuberg webinar, or they're kindly supporting this, I'm sure everybody's familiar with some of the PhotoExpert products, or have been educated or used in their regular practice. So again, signs and symptoms could be dry or flaky skin, or visible cracks, or change in texture of the skin even. So some quick solutions right off the bat: increasing hydration, and to help increase the amount of water that's in the skin. And I'll just take a minute on this one, because I can't believe the number of people that I hear say, I don't like drinking water. And it's one of those things. I've done some research in hydration, and it just boggles my mind at how important water is for our overall health, and people's hesitancy or resistance to drinking it. So if you are hearing this from some of your patients that have, or clients that have skin issues, help them with the hydration. Add some lemon juice, some lime juice, or there's even, if it is such an issue, you can get some 0-calorie flavor things to add to water. But it's so important for our health, especially in the middle of summer. It's something that shouldn't be an issue, but it continues to be. So just my little hydration rant for the day, but that's the easiest thing we can do to help maintain our skin health. The second component is the omega-3 fats. Those are one of the types of fatty acids which are really important for our skin health overall, and then also as topical skin support. So just quickly switching over to our next slide, we can see some of the aspects that go into PhotoExpert. I think this is a really top-notch topical support for maintaining skin integrity, maintaining that skin armor, or helping your patients or clients address some of those issues, whether it's just dry skin or flaky skin. And this is something that we've worked with a few clinical sites here in Canada on, is providing what Manny and I like to call an inside-out approach, is taking the PhotoExpert with the key skin lipids, going on topically, and then supporting the patient or client skin health by correcting any of the fat deficiencies that they might have through our frontline omega-3s. So it's not just about nerve health. Omega-3s are needed for so many more functions throughout the body, and we can really see a great response to patients who have skin issues by combining the two products together. So skipping over, or continuing on now for pain and inflammation. And again, signs and symptoms, it could be acute pain, it could be acute-ish aggravation of a chronic condition, or it could be chronic pain. We can also see, depending at the issue, possibly heat at the affected area, indicating inflammation. And also, depending on how the patient or client comes to you, there could be a component with altered gait, or something that you can assess that way as well. Depending on what could be the issue, if it could be more of a sports injury, or something orthopedic, it's possible that the individual could be referred out for imaging if you think that's appropriate. Perhaps it could be an offloading issue to try and protect a certain portion of the foot. Or there could be aspects of symptom management. If it's an arthritis situation, then again, reducing inflammation through omega-3s, through CBD, through other components could be indicated as well. But again, it's a matter of developing that relationship with your patient or client to help really discern what might be the issue at play. So our final component, coming back to the immune system, and slow healing time, risk, or slight progression to diabetic foot ulcers or infection, or even conversations with your patient or client. If they seem to be people who are really prone to seasonal colds or other things that you can discern that might be related to their immune system. Again, it's a bit of a touchy time for talking about immunity right now, especially showing symptoms of anything, but it's still worth having it's still very important to have a conversation and keep your lines of communication open. And again, seeing some secondary fungal infections or other infections could be, again, a sign of immunity issues. Depending on how the patient or client presents, what you know, this could be an individual that could benefit from the support of a dietitian, or some more structured support for their overall eating habits. At the simplest level, supporting the immune system with supplemental vitamin C, as well as a probiotic supplement, would be great additions to boost the general immune system and also the gut microbiome for boosting our internal defenses as well. And as well, always very important is trying to incorporate more alkaline foods, vegetables, leafy greens, those sort of things that can counteract the acidity of sugar or processed foods. And again, sugar, processed foods, those things all can contribute to an environment which can suppress the immune system. So again, if this is something that could be going on longer term, it could be outside of your scope of recommendations. So if you know, depending on where your practice or your location is, if you have somebody that you can refer patients or clients to that you know or you've networked with, that's always a great support to help maintain the health of the foot overall. So with that, I'd just like to thank Neuberg Healthcare and Manny and Martha for their support in putting this webinar on. I'm thankful to be here and share some of my information with a great group of people. And I know I was preceded by some amazing speakers, and there will be, excuse me, there will be more to come in the next few weeks. So I look forward to attending and listening to those talks as well. Just a few notes. Some of the products that we mentioned here today are available through the distributors that are listed here throughout Canada and a few into the US. And I think we just want to note there's a new distributor here in Ontario, OMMS, Ontario Medical Modality Supplies. You can reach Ron or Mike through email at that. And I thank everyone for their time here tonight, and I'm going to pause the recording and we can open it up for some questions.